So, if you had a really significant amount of money that suddenly came in a donation tomorrow, where do you think the first place to allocate it is, or to that you
Well,
would place that?
right now we're really doing research. You know, the surveys are important, and sometimes I feel like, you know, I want to take action, you know, on the
Right.
survey. But we decided we were all ready to take action on the solicitation survey, and then we said, wait a minute, we got again limited resources. What action are we going to take, and what's the most intelligent way of taking action, and what's the best target for that? So that's what, you know, that's what we are doing. And in the meantime, we do invest, you know, we do invest in fundraising, we do invest in graphic design. We had a big presence in Pride. We were spending a good deal of time and money. It's time too, right? Because you have your
Mhm.
people spending time and effort on Pride. That kind of disappeared last year, and we're not quite sure what's going to happen this year. But that was a big effort. I just think, to put in perspective, you know, Intact America was founded with $1 million donation in 2008, and same-sex marriage, one donor, Tim Gill, gave $450 million for that to come to fruition. And lots of other people gave money too, but Tim Gill alone gave $450 million, $500 million. So before, you know, people um, dismiss the effectiveness of our movement, which, you know, has gotten, or our organization or our movement, which has probably mobilized, you know, total $5 or $6 million over a period of 20 years, right? I think it's important to keep in perspective. If 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 all you had to do was be right and have an initial investment, you know, Coke and Pepsi wouldn't still be warring on the airwaves, right? Um, your TV experience wouldn't be 35% commercials. If Allstate really was the best insurer, or Progressive or whatever, they just tell you once and hey, you know, they're done. So I think it's important to recognize that cause related marketing is still marketing and requires all of the intelligence and strategy and assessment, reevaluation, changing of strategies. It requires all of that over time. You can't just expect to, and people, you know, I'm sure you've had this conversation a million times, Brendon. Um, I think I got it. You know, someone will come, I got it. I got the message. I think if we just said this, you know, then everybody would get it. Talked to a doctor who said, if you just, you know, this is the message, and we just need to start telling the medical residents it's going to spread like wildfire. Well, no anti-status quo message, when the status quo is so heavily invested in by the enemy, if you will, right? Um, no anti-status quo phrase, meme, or anything is going to topple the status quo. The tipping point comes, it might come suddenly, but it comes as a result of years and maybe decades and a lot of strategy and a lot of money being invested in toppling the status quo. So that's our charge, really, as a movement. That's what we have to do, and it's tempting to think that um, that we're going to be successful with the right phrase or the right um, zinger, you know, kind of. And those are important. I mean, phrases and zingers and messages are super important. But, you know, don't think you failed if circumcision didn't go down from what we thought was 58%, you know, it's higher than that, down to 2% in the 5 years since your organization was created, or the 10 years. It's just not going to work that way.
So I've heard you use that phrase tipping point before,
Mhm.
and I was
Right.
wondering if you could define what that is and what you think the path towards that is.
Yeah, well, we didn't make that up, right? That was Malcolm Gladwell's book, The Tipping Point. And a tipping point is the time when a critical mass of people accept your alternative to the status quo. So in the case of intactivism, you want a critical mass of people or to accept that keeping a boy intact is fine, right? Not like the best things in sliced bread, but okay, it's good. Same-sex marriage is a great example of a tipping point because you didn't see this kind of gradual change in people's attitude toward gay people. You saw, tremendous amount of money invested in it, and then you one same-sex marriage, was accepted as either good or fine, not important, who cares, right? Face it, most people aren't passionate about same-sex marriage. And we don't need most people to be passionate about foreskins or about not circumcising. We need people to go, oh, yeah, okay, that's fine, that's good. And once a critical mass of people can accept that alternative to the status quo, that's when you see behavior change. And that's why it happens quickly. But it happens quickly, but after often many years or even decades of work on the part of activists. So tipping point is our strategy, and everything written about social movements indicates that that tipping point in popular opinion is not majority. It's more like between 20 and 25% of people. There'll still be some active opposition. Most people just won't care. And that's what we are aiming for. And what we're doing to help reach that tipping point, for one thing, we're measuring, right? Just like we measured the survey, and we've seen a change. We haven't done a tipping point survey or an attitude survey in a couple of years. And since we started doing it, we've moved from 12 to about 16% of people who are ready to accept the status quo, ready to accept the alternative to the status quo, which is that boys should be kept intact. They should accept that. But that's what we are. That's what we're aiming for.
And what do you think the path to that change is? Is it this sort of slow messaging over time? Is there something that would accelerate it more? I've heard a tipping point or social change described as it's a bit like going bankrupt. It happens very
Mhm.
slowly and then all at once.
Right,
So
right.
I'm curious if there is something that gets people closer to that all at once faster, or in a way that's easier to do, or is that still something that you're finding through the research and,
Well,
your
I
own?
think we're still working on it, and I don't think we have the exact answer, but I think that it's a big revelation that we're not. I mean, we're trying to change public attitudes, but we are pushing a boulder uphill because of the machine that we are that's overwhelming us, right? The kind of almost silent um, um, financial and cultural um, pushing of circumcision and the incentives, right? So um, that's what we're trying to figure out in how do we act on these survey results, right? So who are the power figures? Who are the authority figures? So in our case, unlike same-sex marriage, where ultimately you were looking for a legislative solution, a legal solution, right? I don't think we're ever going to have that with circumcision. I think that the religious, organized religion is going to, even in countries, where there's almost no religious minority that pushes circumcision, they they rise up, if there's any talk about legislation against it. So I don't think we're going to get that, but I think that if we can realign incentives or recruit help from the participants in the machine. And that's why we're thinking now that nurses are good allies here. You know, as people start, there aren't enough parents to make the tipping point happen. You only have what, maximum 4,000 million births a year in a country of 340 million people. It's like I once heard same-sex kindergarten has the smallest constituency of any political issue. I mean, did I say same-sex? All-day kindergarten, sorry. All-day kindergarten has the smallest constituency because once your kid's out of kindergarten, you don't care anymore. And we have a lot of really passionate moms, but they're passionate, you know, about keeping their babies intact. And some of them become ongoing activists, but most don't. They go back to their family life. So we need to recruit and bring along people who are part of the machine and get them to tell us what it would take to break the cycle that they're in and to dismantle the incentives. Some of that change could happen with big financial changes in our healthcare system. I think that some of those are underway. I don't think we're going to have a universal healthcare system. You know, most of the countries that don't tolerate circumcision have a universal healthcare system where all the incentives are aligned. You know, unnecessary things aren't paid for. And doctors don't get compensated for doing unnecessary things. We don't have that in this country. Nonetheless, there are financial pressures. Right now, what you're seeing is the hard sell is partly because I believe, but we don't have the data on this. We did ask parents, the moms, who paid for the circumcision. We found it was a mix of self-pay and third-party payer, either Medicaid or private insurance. And there's something I'll say about that in a moment. So we asked that, but we think that the hard sell is also to get parents to pay, even when their insurance company says no. And that will erode possibly over time, unless, you know, you can really just convince people they got to have it. So, you know, all of those things come into our. I'm kind of trying to think. I'm trying to give you really thoughtful answers. We're struggling with this ourselves into how to best address it. As somebody who worked in healthcare and Medicaid for years, I ran a Medicaid managed care plan in New York. I see the efforts to get Medicaid to stop paying for circumcision in various states to be ineffective. And that's partly because people in this country are very confused about the way healthcare is organized. It's easy to be confused, but might be of interest to people to know that California Medicaid has never paid for circumcision, which means that if you send a bill to California Medicaid for circumcision, for routine circumcision, California Medicaid won't pay it. Well, guess what? California Medicaid doesn't pay for anything fee for service. They farm it all out to private insurance companies to manage care plans, and the managed care plans can do whatever they want. So Kaiser Permanente in California pays for routine circumcisions, whether it's for their Medicaid patients or their, employer-based patients, if the employer wants it, right? That's part of their negotiation. It's my understanding that many of the managed care organizations in California pay for circumcisions, for routine circumcisions. In New York, a decision on the part of legislators to not pay, which will never happen because the religious lobby is too strong, but wouldn't make much difference. The private insurers will keep paying for it. As soon as you see something in insurance lingo described as a benefit, That's literally what we call what an insurance company pays for. It's a benefit. As soon as you see something described as a benefit, then to suggest that you don't cover it means you're depriving somebody of a benefit. And that's very much what a lot of the discussion around Medicaid and insurance companies paying for circumcision is.
So that's an interesting use of the word benefit, because very often people who are pro-circumcision will talk about the quote unquote benefits of circumcision. Right. Is that language benefit chosen because it's also insurance company language? Or is that just okay.
I think so. You mean chosen by like the AAP that says the benefits outweigh the risks?
Yes, and organizations like that.
I don't know if they choose it for that, but it's instructive to know that what follows that, like for example, in the AAP 2012 task force report, is that, and the benefits are sufficient to justify financial access to the procedure, which means to justify insurers paying for it. So the AAP is there, that just tips their hand completely, right? They want doctors to get paid for circumcision. So they throw into their, so that the AAP's argument goes, benefits outweigh the risks, even though the risks have never been systematically studied. And the benefits are sufficient to warrant financial access to the procedure, which means insurance companies and Medicaid paying for it. And then the next step when it comes to poor people, and is that you wouldn't want to deprive poor people of this benefit. So that's why you have Medicaid funding. You wouldn't want people to be stigmatized by not being able to get that beautiful circumcision just because they don't have the money. This would be an example of how, low-income boys would actually truly benefit if Medicaid didn't pay for circumcisions. But that's just.
It sounds like part of the challenge you're facing is just how complex this system is, where Medicaid says we don't cover it, but there are these private insurance companies that do, and a lot of the language has a double meaning where it might be saying what most people would think of as a medical benefit, but it's also talking about financial benefit.
Talking about the benefit being financial compensation to the doctors.
Yeah.
Right. Yeah. I mean, you could torture this to death, but the truth is that part of the AAP's advocacy is to get payers to pay for this medically useless and harmful procedure.
Thank you for listening to the Brendon Marotta Show. If you liked this episode, please share it with someone else who would also like it, and then go on whatever platform you listen to the show on and leave a positive review. If you want to support the show directly, go to brendonmarotta.com/show and subscribe there. Paid subscribers get special unreleased bonus material and live events that are only available to them. Once again, that is brendonmarotta.com/show. Thank you for listening, and I will talk to you all later.